you enjoyed your lunch, so thank you for joining us for this presentation. So, what is the title of the presentation for this afternoon? Enablers of Patient Access to Healthcare Data in International Comparison. So my name is Fahreen Walimohamed, and I'm going to be presenting on behalf of myself as well as Kareem Keshaji. So let's get started. All right. So what's the agenda for today? So first, I'm going to start off with an introduction to give you a bit of a lay of the land, and then we're going to go into the methods. So what are the methodologies that we apply to this study? And then from those methodologies, what did we observe? So that will show us our results. What did those results tell us? That will be our discussion. And then I'll wrap it up there, and I'll open up the floor for any questions that you may have. All right. Okay, so the introduction. Like I promised, I will give you a lay of the land. So let's take a step back here. So I'm going to share some personal stories on why this topic is so important. We hear a lot of patient access to healthcare data, their health records. It seems like a buzzword. But why is this topic so important? So, like I said, let's take a personal journey with me. So about 9-10 years ago, I had an injury. And so my family physician, she ordered x-rays and ultrasounds for me. So I had them done. And when I finished, I asked them, can I have a copy of my x-rays and ultrasounds? They told me, sure, but you gotta pay $10 for a CD. So I'm dating myself right now, and I had to pay those $10 for the CD, and I got it. And so I also kept track of all my lab results, my blood tests. I had a paper file that I carried with me, including my CD, when I went to the family physician, when I went to my physiatrist, my sports physician, my chiropractor, my osteopath. It went along with me. I remember that day when I came home from my x-ray and ultrasound, my sister said, I would not have known to ask. She's here. She's in the legal field. She's a lawyer. And she said, I would not have known. All right. Fast forward to today, current state, 9-10 years later, I got injured again. I'm a magnet for trouble. So, once again, my family physician ordered x-rays and ultrasounds for me. I went, I got them done. When I was finished, I asked the front desk staff, can I have a copy of my ultrasound and x-ray? And she said, sure. She gave me a paper, which had an activation code and a PIN, so I could go access it on a patient portal. Okay, so 10 years later, we made some progress. I didn't have to pay $10 for my own data, and I was able to access it on a patient portal. But the key piece was I asked for it, right? That's because I would consider myself, because I'm in the health space, I have high health literacy. Most people would not know to ask for that. Okay, so that's the patient side. I'm going to switch gears here. I'm going to talk about the vendor side. So right now, I work for a vendor. We are a telehealth and patient portal in the mental health, behavioral health space. We are integrated with specific EMRs, electronic medical records. One of the features we released was view client data. So this means certain data points from the EMR integrate into the patient portal. That includes lab results, diagnoses, medications, your care team, you name it. Now, as a vendor, you cannot withhold patient data from the patient. However, our clients, hospitals, organizations, clinics can ask us to not share certain data points. Quite common with my clients, they will tell me we do not want the diagnoses to be shared with the patient because it may cause some uncertainty, they won't be sure, or they'll become overwhelmed. Yesterday, I released an episode of my podcast, Empower Speaks Healthcare Talks, where I had a physician on the call, and I broached the subjects to him. And he said to me, in his biased opinion, it may be bad news, but that data is the patient's data. It is their body, their health, so they get to decide. So given that there may be some uncertainty, whether you give them bad news today or tomorrow, they need to have that autonomy, right? So just wanted to share all those moving pieces as to why this topic is so important. So what that goes to say is that patient access to their healthcare data is a fundamental right. This is cemented in the 21st Century Cures Act in the United States of America, our neighbors. Now, just doing an environmental scan, Canada has faced some challenges in making this a reality for having timely and comprehensive access, patient access to their health records. All right, so let's keep moving ahead. So what is the goal of this study? So we're going to develop and test a tool. When you think of a tool, you think of a hammer, or you think of surgeons in the OR with their scalpel, right? So here, our tool is essentially going to be a questionnaire. Simple. All right, so we're going to test and develop a tool to evaluate patient access to health records on a global capacity. All right, so let's keep moving ahead. Okay, so what are the methodologies that we applied? Number one, we conducted a literature review, right? So what information is out there to determine, to shortlist certain requirements to set up the infrastructure to allow patients to access their health data. All right, so we did all that. We shortlisted a certain amount of requirements. Then we shared this questionnaire with 5 experts from various jurisdictional areas. So we had 5. The ones that we kind of chose were Denmark, USA, Alberta, British Columbia, and Ontario. You may be asking, why did we have 3 different provinces? As you may know, in Canada, health care is delivered on a provincial basis. So they differ from one another, and you're going to see that in this study. So we provided these requirements that we came up with to these experts from these 5 different areas, and we determined from that what were the most important areas. Okay? And so in this questionnaire, there were 3 dimensions, 3 areas that we focused in on. So the first one being jurisdictional capacity. Every area is different. You want to be aware of that, right? So you're cognizant. A lot of the times people say you're comparing apples and oranges, okay. But you need to figure out which are the apples, which are the oranges, so you can figure out and learn from each other. Okay, the extent of access to record components, right? Like I listed earlier, lab results, your medications, you name it, okay? The next piece, international comparisons. So, as I mentioned earlier, the argument may be made you're comparing apples to oranges. For example, the states, they are privatized. We are mainly public, right? But there are some private components. And so we need to be cognizant of that when we are comparing and can learn from each other that way. Okay, so that's the methodology. What did the results tell us? We came up with 10 requirements in total. What were these requirements? Okay, so the first one was governance and structure. So this, on an international, national, organizational level, the policies, the guidelines for frameworks to allow patients to access their health data. Single point of access. So having a patient portal, right? I access my X-ray and ultrasound. Okay. Like I mentioned, the vendor that I work in is also a patient portal in the mental health space. So that will be another patient portal that I need to log into. That is why it's important that it is a single point of access, so my data is not in various areas. Access to the full records is not choosing what data should be made available and what should not be. It is your data. As a patient, you should have access to it. A lot of the time, we talk about patients as if it is external to us. We are all patients. It doesn't matter your title. It doesn't matter your profession. We are all patients. We need to be cognizant of that. Okay, timely access, right? To make an informed decision, you need to have readily be able to access your data. Even your clinicians, if they do not receive your data in a timely manner, they cannot make an informed decision about you. That applies to you as well as patient. Interoperability, the ability for the systems to speak to one another. Patient engagement. Patients should be an active stakeholder in their care, and we forget that. So that is access to my data. I may not understand it, but at least I have it. So if I'm being seen in a different province, my data is coming with me, and they can help me interpret it. Right? But that also includes other digital health tools that you may be using. That's all part of you, kind of self-monitoring, you name it, is having you part of that. Data security and privacy laws. We talked a lot about this morning, and it is very important, right, that your patient data is protected, right? If there are breaches, there are consequences, legal consequences for breaching that. Informed consent. We also talked about this morning. You need to be transparent with your patients, right? Even if there's an option to opt out, they need to be aware of that. Digital literacy. I talked about it earlier where I said I potentially do have high health literacy. When I came home, my sister said I didn't know that I should have asked that or I would ask that. So another factor you need to take into consideration is social determinants of health, right? Socioeconomic status as well. So a lot of the time to think of this, just being tech savvy, okay, that's one aspect of it. But when you go to socioeconomic status, right now in my current state, when I work with clients, there are certain patient populations that may be homeless. Right? So if you take that into consideration, they may not have a phone. They may not have a smartphone, or if they have a phone, it is not a smartphone. You need to be aware of those pieces as well, right? And so digital literacy is another layer of health literacy. So now you're just complicating it, but we need to address it and are aware of that. Last but not least, access to your appointments, testing, prescriptions, all of that, right? Self-serve, be aware of it. I had a virtual appointment a couple of weeks ago. My family physician prescribed me a prescription. I got a phone call from the pharmacy that, hey, the prescription is ready. I was not even aware that after that appointment she had prescribed me something, right? That can catch you off guard. I was like, wait, did she not tell me something and that's why I'm being prescribed? Right? So all these pieces I didn't know. So these are the 10 requirements. Let's keep moving. So as I told you, we had these 5 experts of these various areas and we validated this questionnaire. And from this, we were able to determine Denmark, which is not a surprise, is a leader in this area. They're a leader in various digital health aspects. So that was a no-brainer. Then came Alberta. And you may be wondering, okay, Alberta's all the way there, but Ontario and British Columbia are at the bottom. Like I said, we are regulated in a way that healthcare is delivered on a provincial basis. So there are nuances. Nuance number 1, Alberta rolled out Epic, their electronic health record, throughout the province. In Ontario, we are a mixed bag. We have some Epic, we have some Cerner, we have some Meditech. That is another layer of complexity, right? So that also adds to this. In between, we have the USA. And yeah, we can argue they are privatized, and that plays in their benefit, I would say, right? So for example, as an insurance company, Kaiser is one of their big ones. They're going to be very efficient when it comes to using their resources, right? So you use their set amount of hospitals and all that. They're not going to mindlessly duplicate tests and all that. They'll be very consistent and very efficient that, hey, you had blood tests in Clinic A, now you're being seen in the ER. There's no reason to duplicate a test. It's going to be in their system. All right, so this is what we observed from the results, starting with Denmark and then Ontario and British Columbia tying at the bottom. Okay, so just going to wrap it up here. So, as we know, Denmark was the leader. Canada has uneven progress in the various areas across the provinces. There is, focus that needs to be done on interoperability and digital literacy that we talked about quite extensively. And patient engagement is critical. I'll even call out in our study, right? It is a limited study. We have a sample size of 5, and we are cognizant of that. But it is showing you that there is value here. It's a foundation that work needs to be done. And also, patients need to be involved in this process. A lot of the times we talk about stakeholder engagement, we do not bring patients to the table. So calling this out ourselves here as well, that patient engagement, patient feedback is also critical here. The last point that I want to tap into is the assessments and the international benchmarking. What do we mean by that? In this study, it's a foundation. We did this assessment once. Okay, so we are here. Next year, let's do it again. Right? That's what we mean by benchmarking. You started somewhere. Next year, do we make progress or are we at the same level we were last year? So that is the purpose of this. It's a starting point. It's a foundation that we need to evaluate these requirements so that way we can make progress and continue increasing, which is the call to action, increase patient access to healthcare data or their health records. So thank you. I will open up the floor to any questions. Thank you.
Hi, thank you for your presentation. That was really interesting and very important. I find that we don't talk about patient portals enough. Having said that, I actually have a question, but before I ask the question, just for context, did this study include community healthcare or only hospitals and primary care?
So when we talk about the various requirements, we try to be as holistic as possible. I'm cognizant, I know you raised this question earlier about community health. So just for the audience as well, like you said, we talk a lot about hospitals, so acute care, we talk a lot about primary care. So when you say community care, just so the audience is aware to what pieces you are referring to, do you mind elaborating on that as well, just for the audience?
Yeah, so by community health care, I mean home care, PSW services, nurses that are going out and providing care in their homes with dignity, as well as long-term care and supportive housing. So that's what I mean by community health care. I know the word community is thrown around a lot, and especially with primary care, community primary care is very separate from actual community health care. And so you said you were being holistic with the data, correct? That was easier? Okay. So my question for you is going to pertain to informed consent and digital literacy. So our organization currently launched a family portal. It's called a family portal, but it is a patient portal. And it includes access to care plan, it includes schedule, it includes the ability to cancel your visits, add visits, as well as other features. And so my question is, there can only be so much that you can do for your clients or patients in terms of digital literacy, but informed consent is such a slippery slope because it is not truly informed consent if they do not understand it. And it is such a complex client base because you're dealing with older adults as well as people that have disabilities, right? And so you have to be cognizant of that. And so I wanted to understand where that responsibility lies and from your perspective, because we can do as much, like we provide them resources, we provide them with documentation, we explain it to them, our care team explains it to them. And so where does that responsibility lie? Because we are complying with legislation currently by allowing access to the care plan, but then where does that responsibility lie? Because it is a complex client base.
Yeah, no, I completely agree. I think in terms of the responsibility, that's definitely a legal question, but I'm still going to share my perspective on that take. So in terms of doing your due diligence and trying to communicate that and give that information to your patients, I think is step number one. Like you said, they may not comprehend that. There may be language barriers, and so there are other pieces that translators and all of that to help with that. But I think the key piece here, like I alluded to earlier in my podcast, where that physician said, as long as the patient has the data. So for example, let's say I had my injury here, right? I'm based in Ontario. I go to Alberta, and then something happens. They will not know that I have this injury, I've had it for 10 years, and it can act up again, or what have you. They will not know my allergies, nothing. But if that data is, even let's say I mentioned that I have high health literacy, but let's say I didn't. Even if that data comes with me, and it's aware, then maybe I don't understand what this is saying, my x-ray, my ultrasound, but at least it is with me, so they don't waste time and figure out, okay, Fahreen needs another x-ray, another ultrasound. Her results are coming with her, we know her allergies, so at least they're able to provide me with that timely care without wasting time that way, even though I may not know what my data means for me. But I do think there is, like you said, you still need to at least try to explain to the patient, so there are at least efforts being made to help them understand that, and then hopefully with time, other things need to come into play. I'm not going to sideline that, like you said, that it is a complex item, but I think that's at least one step, that they have the data so they can at least get the care that they need in a timely manner.
Absolutely. Yeah.
Thank you.
I think there was one here.
Okay.
Yeah, that's very interesting point. So sorry for that. We will be asking. Really, that's amazing. What you have mentioned. The question is following. For instance, I'm a patient. I'm a person, and I want to gather all my medical data from different facilities and whatever. So, what do you think in Australia? How much time it will take? Out of just your, so whatever. It's just curious. One thing. Another thing, having this data. Or what then? So I mean, just having it as a Google Disk, whatever, and just then providing access to the physician I want, to the facility I want. This is, or you think about any tools, scrolling through this data and saying, you're missing this point, check it out. You're like 52 years old, you have to check it out, that post-data analysis, whatever, So maybe this also could be some post-production analysis of what we have. So just 2 points, like the average time collected, is it hard from your experience? And then what to do with this data, which I'm really curious.
Yeah, so I think...
And again, thank you for this. Is amazing.
Yeah, absolutely. In terms of the quantification, I think there are a lot of factors, like you said, to be able to pull all that data. As I alluded to earlier, for my X-ray and ultrasound, there's one patient portal. And let's say I was seeking out mental health services, like the vendor I work at, that would be a separate portal, another patient portal. So I think to your point of quantifying that, I think there's a lot of work, so I can't give you an exact number. I'll be completely upfront and transparent. But 1 month, I wish it was that simple. 1 month to pull everyone's data together. I think that would be amazing. But I think to your point, highlight the fact that there's a lot of factors and a lot of complexity to that. But I think it is really important, like you said. And once that was achieved, like you said, what else can you do? I think the example I gave where your data travels with you, you are the carrier of your data. I think how you said that, can it pinpoint pieces for you? So right now, your physicians, they can use certain tools to help them dictate, okay, patient 52 years old, X, Y, and Z. Maybe to your point, also on the patient side, patient-facing, where that data can also speak to them and help them capture certain ideas or what have you. So I think there is that future state, and I believe there's a lot of value to that, but I think to your point, it'll take some time to get there. Yeah, another one. Okay.
Thank you. That was great presentation. And this is more around the enablers and the enablers that you found with Denmark. So I know when you researched Denmark was ranked first, assuming they've solved the patient reporting problem that we're trying to solve. But what enablers did you find that Denmark had that distinguished them? Did they have a single electronic health record or a portal for all patients? And did they implement any like system roles, like the digital navigators that we heard about this morning, that were increasing that health and data literacy for our population?
Yeah, no. So for that Denmark, like you said, I think in terms of the enablers, all the requirements on the screen for the most part, they had all of them hit. So I know the paper's kind of cut short, but in our results, you could see Denmark literally checked off every box without fail. So I think to your point of having a more connected electronic health record and the NHS in Europe and all that, I think that does play a factor in that. I think that's also why Alberta, for example, how I said Epic is being used in the entire province. I think, like you said, those factors do contribute to allow you to be able to increase the patient access. So if it's all using Epic or in Denmark, the NHS, that way that's one system speaking to each other. Right now in Ontario, there are different systems, so that's already a challenge that you have to tackle. And so I think then the next level, okay, so all the data is there, at least for acute care, right? Because Epic or what have you is on a hospital level. I think from that you can pull the information, because they will speak to one another, is kind of pulling that data into the patient portal from there. So I think that's kind of how Denmark has all those pieces in place, that infrastructure and the policies and the governance and all of that to allow them to have greater patient access. So I think those pieces to be able to learn from them, but I think just in general, they have all that in place that allows them to do so at a greater scale than we can in the current state. But I think based on this study, it's a way to learn from them. Okay, they've done this, so how can we learn from that? How can we also implement that for our patients as well?